Good morning, everyone, and today we're going to be showcasing our case study here about phacoemulsification. My name is Angel Tenoyo, and with me is Cyrus Vidal, and let's get started. So, for our demographic data, the name of the patient here is Napa Napoleon Bilale, age 73 years old, sex male, civil status married, and address not applicable. Here in the medics diagnosis is mature senile nuclear sclerosis on the left eye. What mature senile nuclear sclerosis is basically a type of cataract that commonly develops as part of the aging process. It occurs when the central part of the eye's lens, called the nucleus, becomes harder, denser, and more yellow or brown color over time. So, because basically, normally, our lenses are supposed to be clear and transparent, right? It's also called senile because it typically affects older adults, often appearing in people ages 60 and above. So, past medical history not applicable. Then, chief complaint here are floaters. Next, we're going to do the surgery. The proposed surgery and surgical treatments used here is phacoemulsification with intraocular lens insertion using Steclaris PC machine, left eye. Final diagnosis here is again the mature senile nuclear sclerosis on the left eye. What is phacoemulsification? Phacoemulsification is a modern, minimally invasive surgical technique used to remove cataracts from the eye. During emulsification, a small incision is made in the cornea to access the lens. An ultraprobe is then inserted through the incision using and then this probe uses high frequency sound waves to break the lens into small fragments. These fragments are then suctioned out, and then a clear artificial lens called the intraocular lens is inserted to restore focusing ability. So, nursing responsibilities pre-operation, a medical evaluation, including recording details of current medical and history of any allergies is needed. Biometry, this is a series of measurements of the eye, including assessment of the corneal curvature and the axial length of the globe. Discussion with the patients about their lifestyle will take place. This is to determine whether their near or far vision is more important to them. The identification and initiation of treatment for any conditions that may increase the risk of severe post-operative infections such as lid and conjunctival infections. Then discuss with the patient about the information and education of the surgery so that the patient will have all the information and knowledge they need to consent to the surgery and understand what will happen during the whole procedure. The benefits and risk must be clear to the patient before consent is being signed. Next is type and site of the incision. Phacoemulsification uses a small corneal incision, typically about 2 to 3 millimeters wide. Here in the picture, you can see how small the incision is and where the probe will be inserted. Next is a skin preparation. This includes the cleansing of the periocular area. This is the area around the eye, including the eyelids, lashes, and adjacent facial skin with mild aseptic solution. Aseptic drops is also placed into the conjunctival sac to disinfect the ocular surface. And then a sterile surgical drape is placed over the face of the operating eye. This is to basically isolate the operating field and prevent contamination, and so that the surgeon can operate on the area. So types of instruments being um, used here. First is the phacoemulsification machine probe. It uses ultrasonic vibrations to emulsify the lens. Then we have micro forceps and micro scissors. This is used to for precise manipulation of the tissue using surgery. Irrigation aspiration handpiece. This removes the lens material and cleans the lens capsule. Next is the intraocular lens injector. This delivers the foldable artificial lens into the lens capsule. Finally, the microscope. This provides a magnification and illumination of for the surgeon to ensure precision and safety during delicate steps of the procedure. Next, nursing responsibilities intraoperational. First, during surgery, patients need to be able to lie still and must be aware that they cannot move their heads and their eyes. This is important because Um, the face is covered, and this may be initially a frightening experience. Next is a member of the theater staff will act a liaison between the patient and the surgical team. This is usually to support the patients undergoing surgery under local anesthesia. Next is to maintain a sterile field by collaborating with the surgical team to uphold strict aseptic techniques and prevent contamination of the surgical area. And lastly, monitor vital signs by regularly assessing and documenting the patient's BP, RR, HR, and O2 saturation to identify any signs of distress or complications early.
So our first immediate post-operative care is the risk for infrared vision, and the following interventions include is to assess for pain and redness, also intraocular pressure and other vision changes, because early identification of complications can prevent permanent vision loss and ensure timely intervention. Second is to educate on activity restrictions by protecting the surgical site from stress and contamination because it supports healing and preserves visual function. Third is to ensure proper use of prescribed medication because proper medication use prevents complications that can lead to impaired vision. And lastly is to encourage protective measures because eye protection reduces the risk of trauma or irritation that could compromise vision. Our second immediate post-operative care is the risk for infection, and interventions include is to assess for redness, swelling, or discharge, because infection risk is elevated after eye surgery due to the incision site. Second is to educate on proper hand hygiene. It ensures reduced transmission of pathogens to the surgical site. And third is to encourage use of prescribed antibiotic drops so that it prevents bacterial growth in the vulnerable area. And lastly is to monitor fever or pain. Systematic signs like fever or localized pain may indicate an early infection. Our third immediate postoperative care is management of pain, and the following interventions include is to assess pain level regularly. It helps understanding the patient's tolerance and effectiveness of the prescribed analgesics. Second is to administer prescribed analgesics, but medications may address mild discomfort. Third is to utilize non-pharmacological measures like cold compresses or encourage relaxation techniques to alleviate discomfort. Fourth and last is to educate on normal post-operative sensations, explain expected gritty or scratchy feeling, and distinguish it from pain that actually requires medical attention. Our fourth immediate post-operative care is deficient knowledge, and the following interventions include is to assess the patient's knowledge. Understanding the baseline knowledge helps tailor interventions effectively and reduces misunderstandings about recovery care. Second is to educate on post-surgical care. Education empowers patients to actively participate in their care, ensuring adherence to guidelines and promoting recovery. Third is to teach the purpose and compliance of medication. It brings a clear understanding of medication use and it minimizes the risk of complications like infection or uncontrolled inflammation. Lastly, is to address follow up care. Follow up appointments ensure early detection of complications and support. Our last immediate postoperative care is anxiety related to surgical outcome, and interventions include is to assess the patient's anxiety level. Identifying the source and intensity of the anxiety helps prioritize interventions, communications, and reassurance strategies. Second is to provide reassurance and clear information. Accurate information and reassurance reduces fear of the unknown, thereby decreasing anxiety. Third is use relaxation techniques. Relaxation techniques can help lower anxiety levels and foster a sense of calmness. And lastly is to provide emotional support. Emotional support helps patients feel less isolated in their concerns, providing a source of comfort and confidence. So for Pacquiao discharge instructions for eye protection is to don't rub your or press on your eye. Second is if instructed, wear a bandage over your eye for at least 2 days and 2 nights. Also wear a shield to sleep to protect your eye for 1 week. For medication use, you could use antibiotic drops to prevent bacterial infections or anti-inflammatory eye drops to reduce inflammation and pain. For activity level, it is not recommended to drive for 2 days or as instructed by your eye care provider. And also, don't drink alcohol for at least 24 hours. Don't bend at the waist to pick up objects or lift anything heavy for 1 to 2 weeks. Relax for the first 24 hours after surgery. Watching TV and reading are okay and won't harm your eye. And what to expect? It's normal to have the following: mild floaters, itching and mild pain for several days, sensitivity to light, scratchy sun-like feeling in the eye for several days, feeling tired especially during the first 24 hours.